Hello, good morning everyone. I am Jamaica Lofranco and I hold a Master of Science in Nursing degree. I have had the privilege of working in medical surgical unit where I have applied the advanced knowledge and skills acquired through my graduate studies. With more than 10 years of experience in medical surgical unit, I have seen firsthand how advanced education can enhance clinical judgment and decision making. My MSN has equipped me with the ability to critically evaluate complex clinical situations, integrate evidence-based practices into patient care, and lead interdisciplinary teams effectively. So today, I am excited to share insights on how pursuing a graduate degree has profoundly impacted my clinical practice, shaping my approach to decision making and improving patient outcomes. I look forward to engaging with you all and exploring how these experiences can inform and inspire your own professional development. Thank you for your attention, and I am eager to dive into our discussion. So, I want to share a unique and impactful clinical experience that vividly illustrates the integration of the art and science of nursing. This case not only tested my clinical judgment and decision-making skills, but also significantly influenced my values, beliefs, and personal ethics as a graduate level nurse. Several months ago, I managed the care of Mr. Tohachi, a 55-year-old patient with a complex presentation of multi-organ failures secondary to sepsis. What made Mr. Tohachi's case particularly challenging was that he had a DNR or do not resuscitate order and expressed clear preferences about end-of-life care, which complicated the clinical decisions required. Mr. Tohachi was admitted with severe hypotension, altered mental status, and evidence of multi-organ dysfunction. His laboratory results showed elevated lactate levels and renal impairment, which pointed to a severe septic shock. The clinical situation demanded immediate action, including broad-spectrum antibiotics and fluid resuscitations and supportive measures. The art of science was crucial in this scenario. While the science provided clear indications for treatment, Mr. Tohachi's DNR status and his advanced directives presented a moral and ethical dilemma. He had previously expressed a desire to avoid aggressive interventions if his condition became terminal. Understanding the gravity of this situation, I spent additional time communicating with his family, consulting with ethics committee and other colleagues. It was essential to respect Mr. Tohachi's wishes, while also managing his acute medical needs. Through empathetic dialogue, I facilitated a family meeting to discuss his preferences in the context of his current condition, ensuring that they were informed and involved in the decision-making process. From a scientific perspective, the immediate goal was to stabilize Mr. Tohachi's condition. I followed evidence-based practice protocols for sepsis management, including administering IV fluids, antibiotics, vasopressors. I monitored his response to treatment closely, adjusting interventions as needed based on his physiological responses, and lab results. Despite the evidence supporting aggressive treatment for sepsis, the challenge lay in balancing these interventions with Mr. Tohachi's previously expressed wishes. The clinical team and I had to ensure that any treatment provided was in alignment with his goals of care. Evidence from research emphasizes the importance of aligning treatment plans with patients' values and preferences, especially in end-of-life care. Studies show that patients who receive care aligned with their wishes experience higher satisfaction and a better quality of life, even if they do not receive aggressive interventions. In Mr. Tohachi's case, integrating the art and science of nursing meant not only following clinical guidelines, but also honoring his autonomy and previously stated preferences. This required a nuanced approach, respecting both the scientific aspects of sepsis management and the personal, ethical considerations of his DNR status. My graduate level education profoundly impacted my approach to this situation. It emphasized the importance of ethical decision making and patient-centered care, which helped me navigate this complex case. Courses on bioethics, advanced clinical practice, and leadership provided me with the tools to manage such dilemmas effectively. Through my studies, I developed a deeper appreciation for the ethical dimensions of nursing practice. I learned to balance scientific evidence with respect for patient autonomy and to advocate for patients' values and preferences. This educational background reinforced my commitment to patient-centered care and informed my approach to ethical decision-making. This experience reinforced my belief in the importance of integrating both the art and science of nursing. It highlighted the need to approach each case with empathy and respect for the patient's values, even when the clinical evidence points toward a different course of action. My graduate education played a crucial role in shaping my values and beliefs, helping me to align my clinical practice with both scientific knowledge and ethical principles. In conclusion, Mr. Tohachi's care was a profound lesson in the integration of the art and science of nursing. It demonstrated how clinical judgment and decision-making are influenced not only by evidence-based practice, but also by ethical considerations and respect for patient autonomy. That is very important. My graduate education equipped me with the skills and perspectives necessary to navigate these complex scenarios effectively. Thank you all for your attention, and I look forward to discussing how we can continue to integrate these principles into our practice. Have a good day. Bye.